Okay, as for graduated guidance, okay, guidance is intended to be used to improve motor skill and soft skill of the children. Okay, so you as a parents, you as a teacher, so I think you know your best, your parent best. Okay, sorry, your child best. Okay, so I'm pretty sure that you know how much physical assistance is needed for your child. So you know what your child can do or what your child cannot do. Okay, so as the child in the graduated guidance, as the child progress over time, we need to fade or remove the prompt, okay, or physical assistant, okay, because we know that in the graduated guidance, only physical prompt is used as a technique to improve the soft skill. So example of activities that use graduated guidance are hand washing, feeding, toothbrushing, fine motor tasks, and street crossing. Okay, and as we discussed before about the self-monitoring, this is actually intended for high-functioning autism children. Okay, so the target behavior in the self-monitoring, it should be observable and measurable, and then we should have recording system. For example, on this slide, you can see the way the child recording their behavior. Okay, for example, let's say that let's say the child have normally like to scream in the class. Okay, so the target behavior that we want to reduce is no screaming. So meaning that that is the target behavior, but we have to put it in a positive way. So instead of no screaming, we should put it as use indoor voice. Okay, so make it positive for the child. Okay, all right. So for example, this child put it never, 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 meaning that at the end of the day, you can reinforce the child to improve the frequency of targeted behavior. Okay. All right, and the last one, I think this is the last one, is reinforcement. Before I can share with you a few video. Okay, reinforcement. This is common technique. Okay, reinforcement. Sometimes we call it reward. Sometimes positive reinforcement. Okay, so reinforcement is actually to increase in the future frequency of that targeted behavior. So reinforcement is very important. You should celebrate what your child have achieved. Okay, so give them praise, give them something that she or he can eat, and there are few classes in the reinforcement. Okay, the first one is something that can edible reinforcer. We call it edible reinforcer, something that the child can eat. So let's say that she or he have completed brushing his or her teeth independently. So you provide a snack or biscuit to the child. Okay, sensory is you provide something that is pleasant for the sense of the child. For example, you provide music, you provide video on YouTube, and you can also provide tangible reinforcer. For example, sticker, money, token to the child. Okay, and you can also use activity reinforcer. Just provide activity that the child like to. So that's why in teaching occupational therapy students, I always remind them to always evaluate the child interest before they provide the intervention to the child, so that they can use the activity as a reinforcement to the child. Okay, and the next one is social. Okay, for the social reinforcer, it can be praise, it can be positive word or encouragement word to the children. Okay. All right. So let's move to something specific. Okay. All right. to something specific. So let's say that I believe that there's a lot of children with autism out there is a picky eater or have a food selectivity problem. So what we can do when the child have food selectivity, you can use a positive reinforcement. So you can use non-preferred food as intervention. Okay, so by limiting the preferred food, so meaning that you use preferred food as a reinforcement for the child if she or he eat non-preferred food. Okay, that's what we normally use in reducing food selectivity among the children with autism spectrum disorder. Okay, another method that we can use to reduce the food selectivity or to overcome the food selectivity, if the step one or is the technique one is not successful, you may use repeated exposure or escape extinction to the children. So meaning that a child are no longer allowed to escape from non-preferred food. So the technique is you are keeping a loaded spoon in the mouth of the young child with autism until they consume the foods. Okay. All right, the next one is, as I told you earlier, some of the self-help skill problem associated with sensory issue of the child. So of course, the issue of oral sensitivity need to be intervened first before the patient, before the child can engage in doing self-care skill such as eating to brushing or go for hand cutting or dental exam. So dental examination. So it is very easy step that you can learn with your occupational therapist. You just need to applying pressure to the outer layer of the mouth and then to the inner layer of the mouth. Okay, so at the outer layer, you just need to stroke, you just need to put the pressure. Okay, and if you are brave enough as a parent, you can also desensitize in the inner mouth. Okay, by using your hand, or you can use the desensitization stick. Okay, as I showed on the slide. Right, so you have to do gum massage. So just pinching the gum at the bottom and at the upper part of the patient's gum or the child gum. And if you are brave enough and do not afraid of getting bitten by your child, you can also stimulate the tongue as well as the palate of the child. Okay. All right, the next thing is mealtime behavior. All right, this is a specific technique for mealtime behavior. So normally in literature, to improve this mealtime behavior, most studies use shaping, which are a combination of training and reinforcement. And few studies also use graduated guidance, prompting and feeding, and last one is video modeling. Okay. All right, for the dressing, it's similar with the mealtime behavior. Normally, literature suggests to use prompting, feeding, and reinforcement together in combination. Training and graduated guidance, especially with profound intellectual disability, which their IQ is less than 20. All right, video modeling. And of course, modeling demonstrated by a peer, by sibling, or by the parent themselves. All right. For the personal hygiene and grooming, the normal literature suggests the parent to use prompting with the feedback and reinforcement from the parent, and then verbal instruction, reinforcement, and physical prompt. Okay, literature also suggests parents to use visual cues, prompting, feeding, and reinforcement. And last one is modeling, demonstrating by a peer. Okay, for the toilet technique, For the toilet, this is the technique that normally used. First one is graduated guidance, as we discussed before. Visual cues and reinforcement, video modeling, and visual social story. Okay. I think for the Malaysian, you can look at YouTube channel of Genius Kurnia that have a video on toilet training that use visual social story with the child and prompting and feeding technique with the child. Okay, you can Google or you can search on YouTube.